Why me? Many of the symptoms of depression have nothing to do with sadness. Or if your low mood extends for over 6 to 8 weeks, this could be a sign of depression. Here, you lose your interest. The fifth one, decreased self-care. Death should not be taken lightly. Concerning risk factors for depression, which lead to depression or cause depression, there are so many causes. The last stage, which is acceptance. This stage is where a person decides to accept their reality. In movies, they do the therapy in groups. Purple Mind Talks. Hello everyone, I hope you're all doing well. I'm Hajar Razuk and welcome to our new episode on Psychotalks, which is about depression, where we're going to tackle the main aspects of depression: symptoms, causes, types of depression, stages of depression, and treatment. Well, many people use this term of depression, but they don't really know exactly what it is, or if they are really depressed or not. So, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest, also called major depressive disorder or clinical depression. It affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as the life isn't worth living. Depression may require long-term treatment, but don't get discouraged. Most people with depression feel better with medication, psychotherapy, or both of them. Now we need to know about the symptoms of depression, but they differ from one person to another. So we're going to tackle the common symptoms of depression. Depression is more than just a feeling sad all the time. Many of the symptoms of depression have nothing to do with sadness. The first one is constantly low mood. It's normal to experience changes in our emotions. We are all human beings. After all, depression involves a persistently low mood that can feel all-consuming. If your low mood is unchanged by activities you previously enjoyed, or if your low mood extends for over 6 to 8 weeks, this could be a sign of depression. The second symptom is disinterest or avoidance of one's enjoyed hobbies. Here, you lose your interest toward everything that you used to enjoy. With depression, you might find yourself drawn to distraction and that require way less effort. On the other hand, you may feel better if you completely abandon anything that requires physical or emotional engagement. The third symptom, trouble with concentration or memory. Because of its impact on the brain, many people with depression report symptoms of memory loss or difficulty focusing. This could be because depression affects the hippocampus. Here, what do we mean by hippocampus? Is a part of the brain that is located in the temporal lobe that has an important role in the consolidation of information from the short-term memory to long-term memory. And it also affects the brain's hyperfocus on negative thoughts and memories. The fourth common symptom is the significant changes in eating or sleeping patterns. Changes in appetite are common for people with depression. Many people will either use food to repress emotions or increase serotonin. Others sometimes feel complete displeasure from food or have little energy to prepare and consume a meal. Similarly, oversleeping or undersleeping can be a symptom of depression. Oversleeping can be due to increased intrusive emotions causing extreme fatigue, whereas undersleeping can be caused by hyperarousal, which is a primary symptom of post-traumatic stress. disorder, and stress leading to disrupted sleep pattern. The fifth one, decreased self-care. With low feelings of self-worth or increased apathy, it can become harder and harder to take care of yourself. People struggling with depression might forget or avoid basic self-care tasks like eating, sleeping, showering, or brushing their teeth. Number 6, the physical pains and additional health issues. Many people assume depression only really impacts emotions. However, there are many situations in which your emotional state and physical state can influence one another. Over time, depressed interest in activities and changes in eating patterns can affect physical health, which in turn takes a toll on your mental state. Feeling pessimistic or hopeless. Depression can make it extremely difficult to have a positive outlook on life and negatively impact personal self-worth. As a result, someone with depression may experience withdrawal from people and activities. Number 8, increased irritability or anger. It can be extremely draining to struggle with heavy emotions day after day, so it makes sense that someone experiencing depression may become irritable and angry over time. Depression can often feel like a code that filters everything through a lens of negativity, making it challenging to maintain a positive outlook. As a result, someone with a depression may struggle with regulation their own emotions, especially stressful situations. They may find themselves unintentionally snapping at loved ones or strangers when coping with the psychological and physical weight of the disorder. They may also experience heightened anxiety or recurring traumatic memories. Number 8, co-occurring disorders. Sometimes people with depression struggle with other co-occurring mental health disorders such as anxiety, post-traumatic stress disorder, as the acronym is the PTSD, or substance use disorder, SUD. They may deal with extreme self-deprecation or guilt that can persist into state of the helplessness. Number 10, substance use. Emotions are difficult enough to deal with, so understandably someone might turn to coping mechanisms as an escape when those feelings are constantly heavier. In the absence of support and healthy coping strategies, someone may turn to substance or alcohol to numb the pain and control intense emotions, intrusive memories, or waves of anxiety. This is especially true for people struggling with more than one mental health disorder, such as PTSD, anxiety, and depression. The last one, which is the suicidal thoughts or attempts. Depression doesn't always result in suicidal ideation, but it's often the case in more extreme conditions. Having obsessive or intrusive thoughts of suicide is a serious sign of needing more immediate help. Even more casual remarks about death should not be taken lightly. So, as I said, depression symptoms differs from one to another, as it differs from younger children to teens to adults. In younger children, symptoms of depression may include sadness, irritability, worry, aches and pains, refusing to go to school or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. In older adults, there are several symptoms such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems that are not caused by medical condition or medication, often wanted to stay at home rather than going out to socialize or doing new things, suicidal thinking or feelings, especially in older men. Concerning risk factors for depression, which lead to depression or cause depression, there are so many causes. The first one is the biochemistry, which is differences in certain chemicals in the brain may contribute to symptoms of depression. Genetics. Depression can run in families. For example, if one identical twin has depression, the other has a 70% chance of having the illness of someone in life. Personality. People with low self-esteem, who are easily overwhelmed by stress, or who are generally pessimistic, appear to be more likely to experience depression. Also, the environmental factors, continuous exposure to violence, neglect, abuse, or poverty may make some people more vulnerable to depression. Stressful events such as a relationship breakdown, giving birth. Some women are particularly vulnerable to depression after pregnancy. The hormonal and physical changes, as well as the added responsibility of a new life, can lead to postnatal depression. Loneliness. Feeling of loneliness caused by things such as becoming off from your family and friends can increase your risk of depression. Alcohol and drugs. When life is getting them down, some people try to cope by drinking too much alcohol or taking drugs. Drowning your sorrow with a drink is also not recommended. Alcohol affects the chemistry of the brain, which increases the risk of depression. Illness. You may have a higher risk of depression if you have a long-standing or life-threatening illness such as heart disease or cancer. Heart injuries are also an often under-recognized cause of depression. A severe head injury can trigger mood swings and emotional problems. Some people may have an underactive thyroid resulting from problems with their immune system. This can cause a number of symptoms such as extreme tiredness, which can in turn lead to depression. So depression has different types, but in our episode we're going to mention 7 common types of depression. The first one, major depressive disorder, or its acronym MDD. It's a clinical disorder. Persistent depressive disorder, PDD, refers to a type of chronic depression present for more days than not for at least 2 years. Bipolar disorder is a mood disorder characterized by periods of abnormally elevated mood. Postpartum depression, PDD. Pregnancy can bring about significant hormonal shifts that can often affect a woman's mood. Depression can have its onset during pregnancy or following the birth of a child. Premenstrual dysphoric disorder, PMDD. It affects women in the days or weeks leading up to their menstrual period. Seasonal affective disorder, SAD. Seasonal depression usually starts in a late fall and early winter. Atypical depression. Atypical depression is a type of depression that doesn't follow typical medical presentation. So depression goes through 5 stages. The first one is denial. If a person doesn't want to accept that depression is possible, they could just reject the idea altogether. Despite the symptoms of being present for some time, a person may not be ready, willing, or able to think that they could be seriously depressed. The denial stage is usually short. The second stage is anger. If and when denial fades, a person experiencing depression may feel angry about having to deal with it, feeling helpless, or victimized is common in this stage. It's common for a person to ask, why me? This may happen because the person does not know where to go or who to turn to. A person in this stage may also feel afraid that they either will not have the tools to deal with their depression or know who to use them. Bargaining. A person may find himself doing other things to get the depression to go away. They may pray about it to their source of faith and offer to do something else to make their depression fade. The next stage is depression. A person who is living with depression may retreat even further, withdrawing from others and refusing to engage with others or the outside world in any way. They may feel emotionally numb and do things like stay in bed or avoid taking a shower or cleaning up their living space. A person can get into a pretty dark headspace at this stage and may entertain thoughts of harming themselves or ending their life. The last stage, which is acceptance. This stage is where a person decides to accept their reality, that they are living with depression. They may decide to get professional treatment for it at facility, or they may decide to do what they can do to manage it on their own. So we may ask the question, how is depression treated? Before a diagnosis or treatment, a health professional should conduct a thorough diagnostic evaluation, including an interview with a physical examination. In some cases, a blood test might be done to make sure the depression is not due to a medical condition like thyroid problem or vitamin deficiency. Reversing the medical cause would elevate the depression-like symptom. So, medication can be one of the ways of treatments. Brain chemistry may contribute to an individual's depression and may factor into their treatments. For this reason, antidepressants might be prescribed to help modify one's brain chemistry. Antidepressants may produce some improvement within the first week or two of use, yet full benefits may not be seen for 2-3 months. If a patient feels little or no improvement after several weeks, his or her psychiatrist can alter the dose of the medication or add or substitute another antidepressants. So, the other solution or the other treatment can be psychotherapy. What do we mean by psychotherapy? Psychotherapy or talk therapy is often used along with antidepressant medications. May involve only the individual, but it can include others. For example, family or couples therapy can help address issues within these close relationships. Group therapy brings people with similar illnesses together in a supportive environment and can assist the participant to learn how others cope in similar situations. And actually, we used to see that in movies. They do the therapy in groups, or you may invite one of your relatives or the close people that you may have in a group therapy. The other one, which is electroconvulsive therapy, or ECT, is a medical treatment that has been most commonly reserved for patients with a severe major depression who have not responded to other treatments. It involves a brief electrical stimulation of the brain while the patient is under anesthesia. The other solution, which is self-help and coping. There are a number of things people can do to help reduce the symptoms of depression. For many people, regular exercise helps create positive feeling and improves mood. Getting enough quality sleep on a regular basis, eating a healthy diet, and avoiding alcohol can also help reduce symptoms of depression. As a sum of my talk, if you are really depressed, No treatment will help you if you don't really want to help yourself first. So you have to be strong enough to face what are you going through. Ask for help. Go to psychologists. Move on and forget about all what make you down. Get out of your darkness and look for your brightness. Stay strong, stay purple.